prostate cancer, a phrase that can send a chill down the spine of any man, especially those of us who have seen a few more decades. Maybe you're here because you, or someone you love, is worried about what the future holds. Maybe you're just trying to stay informed, to be one of those men who doesn't let life's hurdles sneak up on him. Whatever the reason, I want you to know you're in the right place. Today, we're diving deep into the 12 early prostate cancer symptoms that doctors warn about. These aren't always the kinds of symptoms that barge into your life like a freight train. More often, they're whispers, subtle changes that are easy to brush off as just another sign of getting older. But listening to those whispers, recognizing them for what they might be, can make all the difference. Before we get started, let's talk about why this matters. Prostate cancer is the second most common cancer among men in the United States. That's not meant to scare you, but to remind you that you're far from alone. It's a path many men have walked, and many have come out the other side, stronger, wiser, grateful for every day. And the earlier it's caught, the better your chances are. So, as we go through these symptoms, don't just listen for yourself. Listen for your brother, your father, your best friend from high school. You might just save a life. Let's begin with one of the most common and most overlooked early signs: changes in urination. You see, the prostate sits just below the bladder, wrapped around the urethra. As it grows, whether from normal aging or something more serious, it can squeeze that passageway. Maybe you notice you have to pee more often, especially at night. That's called nocturia. At first, you might blame it on drinking too much water before bed, or maybe that extra cup of coffee. But when it becomes a nightly routine, interrupting your sleep, it's worth paying attention. Another change you might spot is a weak or interrupted urinary stream. Maybe you start, then stop. Maybe it feels like it takes forever to finish, or you have to strain a bit. This isn't just the inconvenience of getting older. Sometimes it's your body's way of waving a red flag. And if you find yourself standing at the toilet, waiting for something to happen, or dribbling when you're done, don't just chalk it up to age. These are signals worth noticing. Hesitancy in starting urination is another subtle warning. If you have to wait longer than usual before the flow begins, or if it feels like your bladder isn't emptying fully, these are clues. Your body, that remarkable machine, is telling you something. Sometimes men notice a burning sensation when they urinate. It's easy to think of urinary tract infections, which are less common in men, but it can also be a sign of trouble in the prostate. Let's talk about blood, a symptom that can't be ignored. Blood in the urine or semen is never normal, and while it can be caused by other things, it's a classic warning sign that something isn't right. It might be just a hint of pink, or it could be more obvious. Either way, it's time to see a doctor. Don't let embarrassment or fear keep you from getting checked out. Your health is worth more than your pride. Now, let's talk about pain. Discomfort in the pelvic area, hips, or lower back can be easy to dismiss. After all, most of us have dealt with aches and pains from years of hard work, sports, or just the daily grind. But if you notice pain that's persistent, especially if it's dull and deep, or seems to radiate from your lower back into your hips or thighs, don't just reach for the heating pad. Prostate cancer can sometimes spread to the bones, and this kind of pain can be one of the first signs. Pain or discomfort during ejaculation is another symptom men rarely talk about. It can feel awkward to bring up, but if you notice a change, don't ignore it. Sometimes the pain is mild, a twinge, a cramp, but sometimes it's more severe. It's your body's way of telling you that something's not right. Erectile dysfunction is another symptom that's easy to overlook or attribute to aging, stress, or other health issues. But if you notice a sudden or worsening problem with erections, and especially if it happens alongside any of these other symptoms, it's time to check in with your doctor. The prostate is a key player in sexual health, and changes there can affect performance in the bedroom. Some men notice swelling in the legs or feet, which can be a sign that cancer is pressing on the lymph nodes, blocking the normal flow of fluids. This isn't your run-of-the-mill swelling from standing too long or a salty meal. It's persistent, and it doesn't go away easily. If you notice this, especially in combination with other symptoms, pay attention. Unexplained weight loss and fatigue can also be early warning signs. We all know the struggle to keep the pounds off as we get older, but if you're losing weight without trying, or if you feel tired no matter how much you rest, these are symptoms you shouldn't ignore. Cancer can sap your energy, stealing your strength little by little. Let's not forget about frequent urinary tract infections. While men are less likely to get UTIs than women, recurrent infections can sometimes be a sign that something is blocking the flow of urine, and the prostate is a common culprit. If you find yourself visiting the doctor for antibiotics more than once or twice, don't just accept it as bad luck. Finally, difficulty in controlling urination, what doctors call incontinence, can be an early sign. Maybe you notice leaking when you cough, sneeze, or laugh. Maybe you feel an urgent need to go but can't make it in time. These changes might seem minor at first, but they're worth your attention. Now, let's take a step back. Maybe you're thinking, these sound like the aches and pains of getting older. Do I really need to worry? That's a fair question. The truth is, many of these symptoms are caused by other, less serious problems, like an enlarged prostate or benign prostatic hyperplasia, BPH. But here's the kicker. Early prostate cancer often doesn't cause any symptoms at all. That's why it's so important to pay attention when your body does send you signals. And it's why regular checkups and honest conversations with your doctor are so important. Let me share something personal. Like many men, I grew up believing that talking about health problems was a sign of weakness. My father, a hard-working man who built his life from the ground up, never went to the doctor unless he was flat on his back. I watched him ignore symptoms, shrug off pain, and push through fatigue until one day it was too late. That lesson stuck with me. Now I see it as a badge of courage to speak up, to take action, to do what needs to be done, not just for myself, but for the people who love me. You might be wondering, what should I do if I notice one or more of these symptoms? The answer is simple. Don't panic, but don't ignore them either. Make an appointment with your doctor. Be honest about what you're experiencing, even if it feels uncomfortable. You're not alone. Millions of men have walked this path before you, and there's a world of support and expertise out there to help you. Screening for prostate cancer is a personal decision, and it's one you should make with your doctor. The blood test for prostate-specific antigen, PSA, isn't perfect. It can give false positives and false negatives. But it's a tool, one piece of the puzzle. If you have a family history of prostate cancer, if you're African American, or if you've had other risk factors, your doctor might recommend starting screening earlier. It's also important to remember that lifestyle matters. Eating a healthy diet, staying active, maintaining a healthy weight, and not smoking can all help reduce your risk, not just for prostate cancer, but for a host of other diseases. Taking care of your health is the greatest gift you can give yourself and your loved ones. I know these conversations aren't easy. No man wants to think about cancer. We'd all rather imagine a future filled with grandkids, fishing trips, and quiet evenings with the people we love. But the truth is, facing these fears head-on, being proactive, is what gives you the best shot at that future. Early detection saves lives. It's as simple as that. So, if you've been feeling off, if you've noticed changes in your urination, sexual health, or energy levels, don't brush it off. Don't let fear or embarrassment keep you from getting the help you need. Talk to your doctor, listen to your body. You owe it to yourself and to the people who care about you. As we wrap up, let's review the 12 early symptoms one more time. Changes in urination frequency or urgency, weak or interrupted stream, trouble starting or stopping urination, burning or pain during urination, blood in urine or semen, pelvic or lower back pain, pain during ejaculation, erectile dysfunction, swelling in the legs or feet, unexplained weight loss and fatigue, frequent urinary tract infections, and difficulty controlling urination. Any one of these could have another cause, but together, they're your body's way of asking for attention. Remember, prostate cancer is not a death sentence. Early detection and treatment have saved countless lives. The key is to stay informed, stay proactive, and never be afraid to speak up. If you're over 50 or over 40 with risk factors, make sure you're having regular checkups. And if you notice any of these symptoms, don't wait. Now, if you found this information helpful, if you learned something new or think someone you love needs to hear this, I urge you to subscribe, leave a comment, and share this with your friends and family. You never know whose life you might touch, whose future you might help secure, just by spreading the word. Let's build a community of men who look out for one another, who aren't afraid to face tough truths, and who choose courage over silence. Stay informed, stay vigilant, and take care of yourself. Your best years might just be ahead.